Great. Thank you so much. It's a real honor and privilege here to be able to share our work, which is a community academic partnership, exactly in the vein of what Dr. Villavesa spoke of. We will be addressing using the framework of community resilience to mitigate gun violence. We started yesterday with a beautiful reading from Frances Henry, where she said that her own vaccine to violence would be finding human connection in her lives. And this is exactly what we're going to explore here in the next 20 minutes. How human connection, how social ties, how building community resilience is one path forward for thinking about how to mitigate and prevent the impact of gun violence in our communities. Before starting, I just wanted to acknowledge our team. We have half of the members here with us today. We're the rowdy table in the back. Here's Pina Violano, Jerry Smart, Sharon Taylor, Ann Green, Teresa Smith-Hines, and Brita Roy, without whom we would not be able to do this work. So this is a representation of our full collaboration. So I will start by covering the background and theory and the methods of our work, and I'll turn it over to Dr. Riley for the results, limitations, conclusions, and interventions and next steps. Like many cities in New Haven struggles with gun violence. In the past 5 years, we've seen a tripling of the homicide rates in our city. And like other cities, this violence affects disproportionately some neighborhoods more than others. Here is a map of our city, New Haven. You can see the darkest areas represent 6 neighborhoods where there's the highest proportion of violent crime. In the greater New Haven area, just to give you some numbers, there are 4 violent crime rates per 1,000 residents. However, in these neighborhoods, the rates are as high as 20 events per 1,000 residents. Probably comes as no surprise to most of you, but these communities are where there's disproportionate residents who are racial and ethnic minorities and living in communities under the federal poverty line. Over the years, New Haven, again, like many communities in our country, these interventions have been driven by government officials, police, criminal justice operations, really thinking about the impacts, the interventions targeting victims and perpetrators. Very few have been led by community members, and very few have focused on the impact of gun violence on the community members themselves. So 4 years ago, community members convened us all, brought together residents, youth, the city of New Haven, members of City Hall, law enforcement, public sectors, including housing, education, and Yale researchers, as well as the hospital, to talk about ways that we as a community could address gun violence. During these conversations, one thing was quite clear. New Haven does a great job in responding to natural disasters. But when there's an episode of gun violence, no one shows up, in spite of the fact that it's a chronic man-made disaster. In a focus group in 2002, one of our community members had spoken up. The day prior, in the public housing unit that she resides in, one of her neighbors had just been shot and killed. And so she spoke courageously. It took so much for me not to break down crying. I know firsthand what it feels like to live in this war zone. It affects me psychologically, emotionally, mentally, physically, and socially. I do so much work in the community, but when I go home, my outreach efforts stop, and I hide in our apartment and don't engage with my neighbors at all. I'm traumatized and know how much I needed for someone to go door to door to see if families and children were okay and needed to talk. Her voice sparked other voices, and soon the conversation really changed in our room regarding the need for more neighbor-to-neighbor interactions, the need for social ties, and the need to address how the community members themselves were feeling living in a community beset with chronic and persistent violence. And so as a group, we turn to this notion of community resilience, and it is defined as the ability of a community to band together and use resources to respond to, withstand, recover from, and even grow from bad events. So in the natural disaster literature, we found a framework to guide our work. And in this framework, there are 8 levers that are represented in the blue, 8 levers that can then bolster the core components, then building community resilience in ongoing disaster. This model was developed by the Rand Institute in thinking about natural disaster, but we feel like it spoke to us in thinking about the ongoing disaster in our communities, which is chronic persistent gun violence. We chose to focus on 2 of the levers that really targeted the neighbor-to-neighbor interaction, engagement, and self-sufficiency. These then would lead to more social connectedness and thus build community resilience in our communities. As a result, the Community Health Violence Prevention Group then convened a smaller resilience steering committee, which was made up of key members, leaders in the neighborhood, residents, as well as Yale University researchers. And this small group then drove the intervention, the design of our research study, the methodology for implementation, and subsequent analysis and dissemination. Acknowledging that we're focused on the levers of engagement and self-sufficiency to build this core components of social connectedness, we examined related constructs of social cohesion and collective efficacy. Social cohesion are the ties that bind together an individuals into a group, and collective efficacy is the ability for that group to leverage those ties on their own behalf for collective action. So the first research question that we wanted to tackle is, are social cohesion and collective efficacy associated with exposure to gun violence in high violence areas in New Haven? The second one, given our interest in an intervention, building community resilience, is, does increasing social cohesion and collective efficacy decrease exposure to gun violence in high violence areas in New Haven? We hypothesized that building community resilience via those 2 levers of social cohesion and collective efficacy will mitigate exposure to gun violence in New Haven. And we also hypothesized that we could actually do it. We could build and sustain a coalition to create the capacity in our most disenfranchised neighborhoods in order to build resilience. This slide here shows our study design. In the pre-intervention phase, we administered a survey, assessed social cohesion, collective efficacy, and gun violence. These are the results we'll present today. We completed this surveying this summer. We're in the intervention phase of building community resilience. And next summer, we will then go back out into the community and assess social cohesion, collective efficacy, and gun violence to compare pre and post our intervention changes in our neighborhoods. Our methods use, from beginning to end, a community-based participatory research approach. This is a well-established, collaborative, rigorous, community-focused approach whereby community members and researchers contribute equally and in all phases of research, recognizing each other's expertise. We developed a 55-item survey, and this included, again, well-established validated measures, the Sampson Collective Efficacy Survey that has measures of collective efficacy as well as social cohesion, the Exposure to Violence Survey, and community-designed questions that really targeted the types of interventions they wanted to do to build community resilience. In total, we trained 17 community members in research survey, administration, in research in general, and this honored both CBPR principle as well as capacity building in our communities to really understand the importance of research and the importance of building the science of understanding the interconnections between community resilience and exposure to violence. We designed a sampling frame in 2 of the 6 neighborhoods on the map before in Newhallville and West River, and we focused in areas that we hypothesized had low social cohesion and high exposure to violence. We used a random walk methodology surveyed between May and April of this summer. And for our analyses in the pre-intervention phase, we used descriptive results and a linear regression model to look at the associations between social cohesion, collective efficacy, our independent variables, and their associations with exposure to violence, our dependent variable. In our post-intervention phase, we'll use a difference in difference analysis, looking at the change in these key variables before and after our intervention. And I'll turn it over now to Dr. Riley.
I'm going to show you many of the results that we came to through our survey. Before I do so, though, I want to describe to you that the act of engaging in research, the act of surveying in and of itself has been a very meaningful and therapeutic activity within these neighborhoods, and the community themselves deeply interested in the results that we would then provide to them. During the months May to August of this year, we visited 300 addresses, completing 153 surveys, essentially split evenly between the two neighborhoods. We had a very low refusal rate of 14%, which we attribute not only to the community-based participatory research approach that we took, but also to the deep relevance that this topic and matter has to the community. We surveyed individuals who are 18 years of age or older. As you can see, the vast majority of respondents were between the ages of 25 and 64 years of age. 56% of our respondents were female. The average number of years in which respondents lived in their neighborhood, 16 years, with an average of 4 individuals living at each address. 56% of the addresses had children, youth, adolescents living within them, and 58% had individuals over the age of 64. The majority of our respondents rented. We asked, how many neighbors do you know? This question came directly from the community members understanding the deep import of asking this question to really understand the neighborhood and the community's experience of living within their neighborhood. In New Hallville, 42% reported knowing either none or only a few of their neighbors. And in West River, this was 57%. When we look to our first independent variable of social cohesion, here we show you the 4 items from the social cohesion scale. These are statements to which the respondents reply on a 5-point Likert scale from strongly agree to strongly disagree. We are going to highlight these 2 results to you. People in this neighborhood can be trusted. 1 in 4 respondents either agreed or strongly agreed with that statement. However, when to the statement, people around here are willing to help their neighbors, 60% replied that they agreed or strongly agreed. This gave us the understanding that social cohesion itself is a nuanced entity. It's more complex than simply being low or high. Our second independent variable of collective efficacy is measured through another scale in which social cohesion is a part of that. Here are 5 more items that appear in that scale. And I will focus your attention here on the bottom 2. How likely is it that your neighbors would intervene if there was a fight in front of your house? Essentially, half of the respondents said that was likely or very likely. And then when asked how likely it is that neighbors would intervene if the local fire station was closing due to budget cuts, 60%, nearly 2 out of 3, responded that that was likely or very likely in their neighborhood. And now we'll transition to our dependent variable of exposure to violence. These are breathtaking results, but results that were not surprising at all to the community. Have you heard a gunshot? Nearly all of our respondents had heard a gunshot. 2 out of 3 respondents had had a family member or friend hurt by a violent act, and 58% had had a family member or friend killed by a violent act. And 1 out of 3 of our respondents had been physically present when someone was shot. When looking at whether there is an association between our independent variables and our dependent variable, we found that in fact there was. As we hypothesized, social cohesion and exposure to violence are inversely related, as is collective efficacy and exposure to violence. As Emily had said, we had also asked community-based questions. Have you ever had a conversation with your children about guns? 2 out of 3 of the respondents had said that they had. If a violent act occurred, 3 out of 4 respondents would call the police as their first action. And approximately half of respondents said that their adult family members had burial insurance, whereas nearly 1 in 3 stated that their child family members had burial insurance. The last question that we asked with our survey was, what 3 things would you like to see happen over the next 1 year to make your neighborhood a better place to live? Here we represent the information that was given to us with that question in a word cloud. We grouped responses based on theme and then entered them into a word cloud such that the size of the word represents the frequency with which that theme came up. As you can see, community, youth, followed by police were the 3 primary themes that came up as we asked respondents this question. Within those, here are some examples of the specific things that respondents gave to us as what they would like to see better about their neighborhood. With regards to community members wanted more get-togethers and community events. They wanted empty or vacated homes to be fixed up, and they wanted their streets and yards to be better taken care of and beautified. With regards to the youth, they wanted a place for the youth to go after school, on the weekends, and during the summer. They also wanted classes for the parents. With regards to the police, there was focus on patrolling, but not patrolling in cars, patrolling on streets by walking and biking and engaging in conversation, police to community member to police, and building relationships. More interaction. Our study has limitations. As you could see from the age distribution of our respondents, we had only 7% of respondents between the ages of 18 and 24 years of age, and this is an incredibly important demographic to this work. We also had a primarily English-speaking team, and we did not have the survey available in a language other than English, and so we, at this point, have only English-speaking respondents. And in certain parts of New Haven, this is a significant limitation. We were geographically limited in our pilot study in that we focused specifically on 2 areas of New Haven. And because this is a cross-sectional study, we cannot determine directionality or causation at this time. There are many conclusions from this work. We want to highlight the first one. Community-based participatory research approach is valuable, essential for identifying solutions to mitigate gun violence and its sequelae. Social cohesion and collective efficacy are associated with reduced exposure of violence, and that a multi-sector approach, including community members and key stakeholders, is needed to address and prevent gun violence. We're now moving into our intervention phase, or we're solidly in our intervention phase, in which the Community Resilience Steering Committee has helped create 2 community resilience teams, one within each of the 2 pilot neighborhoods. These community resilience teams are made of local community residents and leaders who are volunteering their time together to improve the neighborhoods within which they live. These community resilience teams are identifying and then developing local leadership, individuals who live within these communities whose potential has gone untapped to this time. We have designed and distributed community resilience handbooks and toolkits. Dr. Wang is showing you those here, and we have it available to you to take a look at afterwards. They meet bi-weekly. They're building relationships within their communities, going door to door, having conversations at the market, as well as at community events, as well as through connecting with local organizations. Importantly, we are continuing to communicate with city leadership, and the community resilience teams are being increasingly identified as a locus of great power and understanding of the community. We are collaborating with Youth Haven, which is another community-based participatory research project specifically focusing on adolescents and youth engaged in neighborhoods and at high risk for violence. We have many, many next steps. In this photograph, you'll see Ann Green, who's sitting at the table there, along with Sandra Williams, one of our committed survey members, who are walking here. I believe this is West River, going door to door in their community resilience gear, delivering handbooks and making themselves known. You'll also see the photograph there of individuals from different sectors sitting at a table in City Hall. We have the mayor, we have a community member, we have police, we have superintendent, youth services, and public health all at the same table talking about this vital issue. And it's all so that we can put neighbor back in hood, which is the tagline for our community resilience team. None of this work would be possible without an exceptional investment of individuals in a true community-based and academic-based partnership. These are the members on our steering committee, and these are the members of our survey team. We must also acknowledge the Robert Wood Johnson Foundation for their great support of this effort, as well as numerous stakeholders across the city, as well as now across the United States. And before I close, in the words of Margaret Mead, we want to remind you that a small group of thoughtful people could change the world. Indeed, it's the only thing that ever has. Thank you very much.